I'm back to talk about the next section, which is structuring practice, how to train. The reason we consider cognitive practice in motor learning is because we want to determine how to structure training session for voice rehabilitation. Strategies that offer immediate improvement on tasks actually show long-term retention. So the next section is augmented feedback, and augmented feedback is feedback about a performance from another individual or an instrument. This is distinguished from feedback received by one's own auditory system, sensory auditory system. Knowledge of performance, which is abbreviated as KP, is the augmented feedback that provides information about the mechanics of a performance. And then knowledge of results, which is abbreviated as KR, is augmented feedback that provides information about performance outcomes. So KP is internal biomechanical focus. KR is external biomechanical focus. There are studies that show that KR has an advantage over KP for learning. However, more KR is not exactly better. Data shows that fading out the amount of KR across practicing is actually more beneficial for learning. The timing of the feedback is also very important. Feedback given at the end of a behavior is more effective than providing feedback concurrent with task performance. So if feedback is used during voice training, do not expose the vocalist to feedback during phonation. Wait until several vocal productions are completed to give feedback. Feedback in vocal training can also be enhanced by asking learners to rate their success prior to giving extrinsic feedback. Variability of practice. So this is practice under a number of different conditions. For voice training, this means numerous things. For example, using a specific voice quality, such as resonant voice, different phonetic context, varying loudness and pitch, varying physical and emotional environments, using or not using a microphone, indoors versus outdoors, quiet versus noisy backgrounds. And then variable practice degrades performance during therapy sessions, but it's actually significant. It actually significantly enhances learning. So random versus blocked practice. Blocked versus random practice is the disruption of practice trials over time. Blocked is displayed in vocal exercises by many repetition of a specific vocal exercise before moving on to the next. Block does not require a full memory reboot, and that's because some of the recall will still be active in subsequent repetition of the same behaviors in block practice. And then for random practice is displayed by mixing up the vocal exercises randomly. Similar to variable practices, because random practice slows down immediate performance during practice but enhances long-term learning. Important explanation for the random practice is the contextual interference hypothesis. And then their part/whole word practice. So part practice is basically when things are practiced separately and typically happen one after another. This is displayed in voicing by a client practicing one long monologue, one long story, or singing a long song. So basically what happens is each section of the activity is practiced in isolation. So they'll practice the beginning section of the story, the middle section of the story, and then the last section of the story. Some issues may arise in voice training that have negative effects on the client. For example, trying to perform other tasks such as singing and acting simultaneously. So singing in isolation and then acting in isolation have limited benefits on voice training, at least to some extent. So an easier example of that would be the execution of the body alignment, breathing, and vocal fold position and vocal tract manipulation occur parallel. So they happen like all at one time. So it's questionable if you can have an effective approach to vocal training while working on multiple things like posture, breathing, and articulation in isolation. So consistency of a response to a stimulus. So it is important for a client to respond consistently to a given stimulus across trials. An example of this is a constant use of resonant voice for a stimulus that will produce speech. So single/unique mapping is the term to describe the given set of initial conditions to a single outcome. A variable practice is consistent resonant voice outcomes for multiple stimuli. So for example, you'll say speak, sing, shout, and then it's all to one stimuli. So if you can see the image, all the things the multiple tasks are pointing to the one item. So they're all pointing to resonant voice. And then verbal mapping is different outcomes for a single stimulus. So for example, the term speak would be the single stimuli that would map to different outcomes, which would be resonant voice, pressed voice, and breathy voice. And then once again, if you can, the image kind of explains. So you would say speak, and then it would go to these multiple things. And then single and unique mapping versus variable mapping. The difference between single/unique mapping versus variable mapping is that single unique mapping enhances the development for automaticity for skill acquisition, while variable mapping inhibits the development of automaticity. So there are multiple studies varying which is more effective, single/unique mapping or variable mapping. Either way, automatic performance of the task requires constant mapping. So if a client appears to be able to produce a new voice pattern in the clinic or wherever they're receiving services, but they can only do it sometimes on their own outside of the clinic, then they often fail to stabilize the pattern for everyday use. So that means that some level of attention is required before automaticity is acquired. So when you're in the middle of a conversation, it's not easy to think about your voice or what you're doing with your voice at the same time, especially if you're in a conversation with high conversational demands. It gets even more difficult for people who are in voice training, and this is because those people are not only trying to focus on establishing a new behavior, they're actually trying to override their old behavior. It's also hard to override old voicing behaviors because some of the patterns and actions are deeply embedded and some are borrowed from non-speech gestures that the client may have developed over the course of their entire lifetime.